السلام عليكم. اليوم بهذا الفيديو راح أكمل لكم الجزء الثاني والأخير من موضوع Preventive Orthodontic. In this part I will talk about Ankylosis, Frenectomy, oral habit, and finally the space maintainer. First of all, management of the ankylosed teeth. As seen in this picture, this tooth ankylosed or this tooth ankylosed, more commonly in the primary teeth than in the permanent teeth. We can define ankylosis as the condition characterized by the absence of the periodontal ligament in the small area in the root or the whole root surface. As seen in this picture, there is no periodontal ligament, meaning this primary tooth not resolved by the succedaneous tooth. This leads to the succedaneous tooth not erupt, and also can deflate the path of the eruption. To prevent this problem, in preventive orthodontic, ankylosed primary teeth should be surgically removed to provide the space for the eruption of the permanent tooth in correct position. Then the management of the abnormal frenal attachment. The presence, as seen in this picture, the presence of the thick frenum between the deciduous teeth can cause a problem, can interfere with the oral habit, can interfere with oral function. For example, can interfere with lip function. As seen in this picture, this is thick frenum, high frenum attachment between the deciduous incisor. Cause diastema. If only cause diastema and not interfere with function, we can leave it. This diastema, if we want to know if this is diastema due to the high frenum attachment or other cause, this by blanch test, as seen in this picture, forward of pull of the lip forward, then we see the interdental area blanching and white become white. This area become white, interdental area become white. This is the blanch test. From this test, to know this diastema is due to the high frenum attachment. As seen in this case, this patient suffers from median diastema up to 3 mm due to the high frenum attachment between deciduous teeth. Normally, diastema between deciduous teeth, we can leave it. But this patient has suffered from diastema interfering with her lip movement, with lip function. So in this case, if there is any interference with any function, we can remove it. Surgical removal of the high frenum attachment or of the thick frenum to prevent this interference. This is one of the preventive orthodontic procedure. This after surgical removal. Another surgical treatment or preventive treatment is to remove the lingual frenum. As we know, this lingual frenum touches the tongue with the floor of the mouth. If this frenum thick and restrict the movement of the tongue, we know that the tongue helps us to swallow, to speak. So if interference with the movement of the tongue, this is called ankyloglossia or tongue tie, we must remove this frenum. Surgical removal of this frenum to prevent this interference with her tongue movement. As seen in this picture, this is surgical removal of the lingual frenum to prevent any interference. Another procedure undertaken in preventive orthodontic is the oral habit prevention. As we know, the most common oral habit in children: nail biting, thumb sucking, tongue thrust, and finally lip biting. This is the most common oral habit. The parent should be educated about the ill effect of these habits. As we know, the child normal habit, especially in thumb sucking, nail biting, tongue thrust, is normally in the child, especially thumb sucking, feel of the security for the child, especially the few months postnatally. But parents should be educated about the ill effect of this habit. If prolonged, and this depends on the intensity and duration. If prolonged after the 2 years, after 2.5 years, if the child continue this habit, so must prevent the child from this habit. Parents should prevent this child from this habit to prevent the malocclusion in the future. Should be educated about the effect of this habit on the occlusion, on the correct position of the tongue, or correct position of the teeth. So this is very important to prevent any problem in the future. Finally, I will talk about the space maintainer. Space maintainer is another procedure undertaken in preventive orthodontic. It's a very important procedure to prevent loss of the space, to help the eruption of the permanent tooth in the correct position. As we know, premature loss of the primary teeth leads to the loss of the space, leads to the teeth move toward the space, and not enough space, and this leads to the not enough space for eruption of the permanent tooth. Loss of the space, as you see in this picture, also may lead to the midline shift or crowding. So we can define space maintainer as the device that's used to maintain the space created by early loss of deciduous teeth. To prevent space loss, so we need device named space maintainer to prevent space loss, to allow the eruption of the permanent tooth in the correct position as possible, to prevent any problem in the future, any crowding, any midline shift in the future. The objective of the space maintainer: preservation of the space, preservation of the integrity of the dental arch, preservation of the normal occlusion plane. In the case of the interior space maintainer, especially premature loss of the interior deciduous teeth, it should be aid in the aesthetic and phonetic. Not only function, aesthetic, especially the aesthetic for the child, to prevent any psychological effect. Also, space maintainer should be simple in construction, should not interfere any growth of the jaw, no any interference with the growth of the jaw, and also should maintain the oral hygiene as possible. Factor affecting planning for the space maintainer. First, the time elapsed since loss of the tooth. This is very important because maximum loss of the space occur within 2 weeks to 6 months. So, after loss of premature loss of the deciduous teeth, if premature loss more than 6 months, this contraindicated for the space maintainer. We cannot use the space maintainer because the space loss maximum 6 months. So after 6 months, space maintainer is contraindicated. So it is recommended to fabricate the space maintainer before the extraction and to be inserted at the time of the extraction to prevent this problem, to prevent loss of the space. The second factor, stage of the root formation. The developing tooth bud began to erupt actively if the root 3/4 form. So if the permanent tooth or root 3/4 form, meaning this lead to the eruption early. So not need any space maintainer if the root of the permanent tooth 3/4 form. Another factor, thickness of the bone covering the erupted teeth. Also, this another factor is very important. According to the McDonald, 1 millimeter of the bone resorb in 4 to 5 months. And so if the bone is present over the succeeding tooth, is an indication for the space maintainer, as seen in this picture. If this bone if this area covered with bone, 1 millimeter resorb in 4 to 5 months. So if the bone present 1 millimeter or more, meaning that the tooth not nearly erupted. So we must put the space maintainer to prevent the space loss as possible. If there is no any bone, only soft hard tissue, so this meaning the succedaneous tooth nearly erupted, so not need any space maintainer. But if bone covered, especially more than 1 millimeter, this is the indication for the space maintainer. Delay the eruption of the permanent teeth. Another factor, over-retained teeth, as we remember in previous slides. Ankylosis, meaning the tooth not resolved. So sometimes after removal of the ankylosed tooth, to allow the eruption of the permanent tooth, in the X-ray, we see that the permanent tooth not nearly erupted. To prevent loss of the space, some cases need the space maintainer to maintain the space for the eruption of the permanent tooth as possible. Type of the space maintainer. We have two types of the space maintainer: removable space maintainer and fixed space maintainer. As seen in this picture, this is the removable space maintainer. From its name, removable, it can be removed by the patient. The advantage of removable space maintainer: we can easily clean the denture. Also maintain the vertical dimension as possible, especially in the anterior area. Premature loss of the deciduous teeth anteriorly. Also can be used with another combination. We combine it with habit breaker. This is one of the advantage, very important advantage. Also can be worn by the patient part-time, not fully time. This also allow for free blood circulation. Can be made aesthetically desirable. Also stimulation of the permanent teeth eruption. Keep the tongue in its position. This is the advantage of the removable space maintainer. Disadvantage: may be lost, may be broken by the patient, need the cooperation of the patient, may irritate the soft tissue. The indication of the removable space maintainer: especially used if the bilateral loss of the primary teeth. If the bilateral loss, one of the indication, use a space maintainer. And also if there is premature loss of the anterior teeth, deciduous anterior teeth, to maintain aesthetic and function. Because removable space maintainer can be functional or non-functional. Functional meaning anterior space maintainer, maintain aesthetic and have function. This is the functional space maintainer, maintain aesthetic, phonetic, and also maintain the space. Non-functional space maintainer, removable space maintainer, this specially used posteriorly, only maintain the space. This is called non-functional, only acrylic, maintain the space to prevent loss of the space, but functional if used anteriorly. And also, when the space maintainer is used for the short period of the time, this is also for another indication of the removable space maintainer. Contraindication: because it needs cooperation of the patient, because removed and we can insert and remove by the patient, so need patient cooperation. This is uncooperative patient, this contraindication for removable space maintainer. Also epileptic patient, contraindication for the removable space maintainer. Patient allergic to the acrylic, this is also the contraindication for the space maintainer. Another type of the space maintainer is the fixed space maintainer. The most common type of the fixed space maintainer, band and loop space maintainer, as seen in this picture. This band and loop. Fixed space maintainer, from its name, fix, cannot remove by the patient, cannot insert or remove by the patient. can be worn continuously without the interference of the patient. This is the advantage of the fixed space maintainer. Cannot restrict the jaw growth also. This is another advantage. Disadvantage of the space maintainer: some appliance or some fixed space maintainer can be interfere with function. This disadvantage of the space maintainer. Also need instrumentation. Also, the disadvantage cannot be used for those patients with high caries activity or high caries teeth. This is the disadvantage of the space maintainer. Also, the requirement of the space maintainer must be simple in construction. Fixed space maintainer and not interfere with the growth of the jaw and maintain the oral health as possible. This band and loop, indication of its use if there is premature loss of the primary teeth on one side, unilaterally, not bilaterally, but also can be indicated bilaterally before the eruption of the permanent central incisor. Lower central incisor can be used bilaterally. One of its problems cannot prevent the over-eruption of the upper teeth. Also, as we see here, this is the loop. This loop can slippage in the gingiva, can cause damage or irritation to the gingiva. So to prevent this slippage, we must put a occlusal rest here in the mesial abutment to prevent this problem. Also, cannot be used for those patients with multiple loss of the teeth, more than one tooth, more than one primary tooth. Also, large restoration contraindication, high caries teeth contraindication. So this is the most important point on the band and loop space maintainer. Modification of this fixed space maintainer, crown and loop. As seen in this picture, this is band and loop. Band and loop. Band on the first permanent molar to prevent loss of the space, to allow the eruption of the premolar in the correct position as possible, to prevent to be impacted or deflect the path of the eruption. Crown and loop, we use here, instead of band, we use a crown, stainless steel crown. For those patients with heavy cavity, large restorative, already need this large restoration or large caries tooth, already need stainless steel crown. So we can put, instead of the band, crown and loop. Another type of the space maintainer is the fixed space maintainer is the lingual arch, as seen in this picture. Lingual arch. Most commonly used for the lower bilateral missing. Bilateral missing after the eruption of the central incisor. As seen in this picture, after the eruption of the central incisor in the lower, bilateral missing, we can use lingual arch. Another type of the fixed space maintainer, distal show. As seen in this picture, this distal show. Mostly used in the lower, not in the upper, because in the upper, path of the eruption in the distal direction of the upper permanent tooth, upper first molar. Path of the eruption distally. So, the mesial movement of the upper teeth is very rare. So this mainly used in the lower distal show only, mainly and only for the lower. Missing of the lower, premature loss of deciduous teeth, first molar, first deciduous tooth or second deciduous tooth, D and E or E, premature loss before the eruption of the 6. This design limited in function, not used for multiple missing, and also not used for those patients with highly carious tooth. with multiple missing, because if multiple missing, if loss of her D and E in the same side before the eruption of permanent high tooth, permanent first molar, we can use removable distal jaw, not fixed distal jaw. Another type of the fixed space maintainer is transpalatal arch. This is for the upper, as seen in this picture. Transpalatal arch, unilateral missing. Only unilateral missing or premature loss of deciduous high teeth. Only unilateral in the upper. As seen in this picture, two band on the first permanent molar of the upper from one side to another side, perpendicular to the palate. This band, because this used unilaterally, because if bilateral missing of the deciduous teeth, bilateral missing of the deciduous teeth, if we use transpalatal arch with bilateral missing, this leads to the mesial movement, already mesial movement of the first permanent molar. To prevent this problem, use only unilaterally. To prevent complication of use bilateral premature loss, to prevent this problem, use only unilateral. Another type of the fixed space maintainer is the nance. Nance space maintainer, as seen in this picture, also from one has 6 to another 6 in another side. From first molar and to the anterior teeth, and fixed by the acrylic, as in this picture. This design for the upper, only for the upper, bilateral loss of or bilateral premature loss of deciduous teeth, most commonly bilaterally, and transpalatal unilaterally. This design, the advantage of this design, can be used for distalization of the molar. Distalization, after we use this design, we put U-loop here, and then the U-loop, we can activate it by opening the U-loop. This opening of the U-loop can lead to the distalization of the first permanent molar, so can be active. These all this type, upper and lower, it's passive and non-functional. But nance, active. Can be active, can be passive. Meaning of the passive and non-functional, only maintain the space. Not any other function, only maintaining the space. But we remember the removable space maintainer can be functional and non-functional also. Functional, especially in the premature loss of the anterior deciduous teeth, to maintain aesthetic, phonetic, and the function. This is the most important type, or the most common type of the fixed space maintainer. At the end of this lecture, the conclusion of this lecture, prevention is always better than cure. Preventive orthodontic at early age as possible can be do so much good for the children than interceptive and corrective procedure. So for the children and parent should be all educated, informed, educated, and motivated to take a preventive measure against dentofacial malocclusion, to prevent aggressive treatment as possible, to prevent aggressive treatment to the future. Prevent aggressive treatment always. Preventive is better than a cure. Remember, this point is very important, and this is the aim of my lecture, to prevent the malocclusion as possible, and educated of the parent about the ill effect of this problem. إلى هنا انتهت هذه المحاضرة. أتمنى استفادتم منها، وإن شاء الله ألقاكم محاضرات أخرى في مختلف مجالات طب الأسنان. وأي أحد يحب يحمل هذه المحاضرة موجودة على موقع سلايد شير Preventive Orthodontics باسم دكتورة سارة الخطيب. شكرا لحسن استماعكم.